Okay, we're going to do some joint play of the cervical spine in a prone position. We're going to do rotation first on the spinous process. We'll locate C6. I'm going to take my thumb and I'm going to move in a rotation or a lateral direction, moving this way, which will turn the vertebra in this direction. Okay. Remember, the vertebrae are on an angle, about a 45-degree angle, shaped in this direction here. So what I want to do, find the spinous process, get on the lateral side, or where the laminar groove is, approximately on the edge of the spinous process, and do a rotational movement or a lateral movement. So it rotates the vertebra. So you're testing for joint play, movement, pain, discomfort, hypomobility. So that's rotation. So I'm rotating it this way. So the spinous process is here and I'm pushing like this. I can do unilateral on the transverse process. So if I want to create movement this way, the opposite direction on the transverse process, find the spinous process, come down, find the transverse process, and do a unilateral movement which creates a rotational force in this direction. Okay, that's unilateral. If I want to go bilateral, find the spinous process, come off the spinous process onto the transverse processes, and do an anterior glide, or actually it's a posterior anterior glide, or bilaterally on the transverse processes. Find the spinous process again, locate, and I'm going to do a posterior anterior glide in this direction. Again, testing for hyper, pain related to the joint movement. Okay, I'm going to demonstrate some joint movement on C1, the axis and atlas. I'm finding the transverse process of C1. So I can find it just below the earlobe here, bilaterally. Taking my thumb, I'm going to apply a rotational force, a unilateral, so the joint is moving this way. The majority of movement at the axis and atlas is rotation, but 50% of the range of motion of rotation, left and right rotation, is at the axis and atlas. So I'm just testing for joint movement. I can also do a transverse movement, again finding the spinous or the transverse process, and this time I'm moving in this direction, testing the movement for hypermobility or hypomobility or pain. And again, I can come in behind and apply a rotational force. I can also go on both sides and do a little bilateral anterior movement, testing for hypermobility, hyper, or pain. Okay, we've got Megan in a supine position, and we're doing joint play again. You can do it prone or supine. It depends on what your comfort is and what the client's comfort is and how well you manage the cervical spine. So what I'm doing, I'm palpating the spinous processes. I'm getting a feel. I usually like to get a feel of the vertebra doing this kind of a motion. This is a general motion, getting a sense of the overall feel. Usually this way you can find the hypomobile vertebra fairly quickly. It's just a general sense. Now, finding the spinous processes, I can, just like I did in the prone position, I can do this in the supine position. I'm going to do a posterior anterior sustained grade 2 on C6, feeling the movement, and then I can slowly move up to each vertebra, doing an anterior glide or a posterior anterior glide. I can also turn the head a little bit and do a transverse, I can also do a movement on the transverse processes with my thumb, a unilateral, applying pressure, so it's a rotational, it's moving the vertebra in this direction. So I'm applying pressure here, and it's rotating the vertebra in a clockwise direction. That's on the transverse processes, coming up all the way up. I can also come up to C1 transverse process here and do a rotational movement. And so it's rotating in a clockwise direction, going this way. Okay. We can also take the web of the hand in between. I can feel the spinous processes on this part of my finger, on the pip, and on the metacarpal phalangeal. I'll put the transverse processes approximately here, so I'll just demonstrate that. So this is what you're going to see the movement. So I'm doing a rotational force on the transverse process. It's rotating it, and I can move up the vertebra in this way as well. So we've showed you posterior, anterior on the spinous processes. We've showed you the, I can do on both transverse processes posterior, anterior movement using both fingers on either side of the spinous process on the transverse processes. I can rotate the head a little bit, take my thumb, go on the transverse process and do a rotational force all the way up. I can take my web of my hand, again, right in through here on the transverse processes and do a rotational force. Okay, and I can take my thumb, or I can take the web of my hand on C1 transverse process. Okay, so we're doing some joint play immobilization of lumbar spine. So you just want to get a sense of feel where the lower ribs are, the iliac crest are, so you know where L4 is and so on. So what I want to show is posterior anterior rotation, bilateral and unilateral joint play at the lumbar spine for testing. So again, the same things apply. You want to make sure the person's comfortable, make sure the back is not in an extended position. And so what I'm going to do is I'm going to just start off at L4 here, and I'm going to do a posterior anterior, and that's applying pressure on the spinous process, and you're moving in a direction like this that matches the angle of the facet joints of the lumbar spine. So again, you're looking for hyper, hypo, or pain related to the joint play you're doing. So that's posterior anterior at L4. If I want to do a rotational, find L4 again, I'm on this spinous process, I'm doing a rotational. So the rotational moves the vertebra in this direction. That's a clockwise direction. Testing again for the same things. And you should do this when you're doing testing, you should do it with all orthopedic testing of whatever region you're doing. Always do joint play with all your testing. Helps to find out if there's problems with the joints. So that's posterior anterior rotation. Now, bilateral, again, find the spinous process, roll off, come on to the transverse processes, applying a posterior anterior force, looking for the same things. As well, you can also do unilateral, which is going on the transverse processes on the one side and doing a rotational force. That's a rotational force this way again. And looking for the things I mentioned earlier.